times I'm asked, what is addiction? I think in the simplest form, it is continued use of a substance in spite of consequences. There are many different definitions, but I think that is the most basic and the most understandable. People continue to use substances or behaviors even though they themselves are no longer receiving satisfaction or pleasure from these behaviors. They continue in spite of knowing that they have health concerns, that their spouse, their family members are worried, that they've even had interactions with the law. Maybe they've lost their job. It's this continued use, this compulsion to use the behavior, which at one point was actually quite adaptive for them. It helped them to be better. It helped them to feel better. Now it is no longer working for them, but they're trapped in this disease and they have a very difficult time learning to escape. We talk about the disease of addiction as being a brain disease. It is not particularly about the substance or the behavior. It's the way in which someone has been genetically predisposed to interact with exposure to drugs and a stressful situation that has them continue to use drugs or behavior in a maladaptive and dangerous, potentially lethal way. So though we talk about the brain disease, we are aware that many folks think of it in terms of the substance that they use, that they are addicted to alcohol or they're addicted to methamphetamine or tobacco. And while, yes, physiologically they are, it is the same disease in the brain. Dr. Nora Volkow from the National Institute of Drug Abuse in the United States talks about this being a childhood brain disease. And so we know that there are lifelong patterns of behaviors as well as use of substances that create problems for people.